All right, let's dive right in. Today, we're going to trace the exact step-by-step path clinicians take when they're investigating a hydrocele. We'll see how they go from a simple physical clue all the way to a definitive diagnosis. It's a fascinating bit of medical detective work. So first things first, what even is a hydrocele? Well, put simply, it's a collection of clear fluid that builds up inside something called the tunica vaginalis, which is just the thin little sheath that surrounds a testicle. You can almost think of it like a small, internal water balloon forming where it's not supposed to be. And that, right there, brings us to the most critical question, doesn't it? How can you be absolutely sure that what you're dealing with is just harmless fluid and not, something more serious? Because a swelling is just a swelling until you know exactly what's causing it. And that's the mystery we're going to solve today. So where does this investigation begin? Well, it starts with a surprisingly simple, almost elegant first step. It's the first clinical clue, and it's called the transillumination test. It's a classic technique that, believe it or not, just uses light. The test itself couldn't be more straightforward. First, you make the room completely dark. Then you take a bright light, like a small flashlight, and you place it right up against the back of the scrotal swelling. And then you just watch. Does the light shine through or doesn't it? And here's what you're looking for. There are really only two possible outcomes. If the whole swelling lights up with this kind of uniform reddish glow, that's a positive test. It means the light is passing right through clear fluid, a really strong indicator of a hydrocele. But if the mass just blocks the light, if it's completely opaque, well, that suggests it might be a solid mass, which definitely needs a closer look. Okay, so the transillumination test gives us a fantastic first clue. It points us in the right direction. But for a truly definitive picture, for the final word, clinicians turn to what is known as the gold standard, the ultrasound. And let's be absolutely crystal clear on this point. When it comes to confirming a hydrocele, scrotal ultrasonography isn't just another option on the menu. It is, without a doubt, the investigation of choice. It's the best tool for the job. So, why is it the gold standard? Well, it does a few absolutely crucial things. First off, it confirms 100% that there's fluid there and can even measure how much. Second, it lets the doctor get a direct look at the testis itself to make sure it's healthy. And maybe most importantly, it can definitively tell the difference between a simple hydrocele and other things that might look similar, like a hernia or, in rare cases, a tumor. So the ultrasound has given us our definitive visual evidence. We've got our answer. But to round out the whole clinical picture, especially before any potential procedure, we need some supporting data. And that's where lab investigations come into play. Now, these are usually pretty routine tests. A complete blood count, or CBC, just checks for any signs of an underlying infection. A urine exam does the same thing for the urinary tract. And things like blood sugar and kidney function tests, that's just standard procedure to make sure a patient is generally fit for surgery if it comes to that. For a simple, uncomplicated hydrocele, these lab results are almost always completely normal. So, the path we've just walked through, that covers the vast majority of cases. But every once in a while, if something seems a bit unusual, clinicians might need to turn to some special investigations. I want to stress these are not routine. These are really only for select cases. One is aspiration, which is basically using a needle to draw out some of the fluid. It's not usually done, but might be an option for older patients who aren't good candidates for surgery. And then you have tumor markers. These are specific blood tests that are only ordered if the physical exam or the ultrasound raises even the slightest suspicion of a testicular malignancy. All right, let's step back for a second. We've gathered all of our evidence from that first little clue of light shining through a swelling all the way to the crystal clear image on an ultrasound screen. It's time to bring it all together in a final checklist and officially close this case. You can really think of the entire process as a diagnostic funnel. It starts broad, with a simple physical clue, a positive transillumination test. Then it narrows down to the definitive evidence from the ultrasound, which is backed up by supporting data from routine labs. And then, only at the very narrowest point of the funnel, and only if absolutely necessary, do you bring in a targeted inquiry, like tumor markers. It's just a really logical, really efficient process. And really, this is the main takeaway. If there's one thing to remember, it's this. A doctor can often make a pretty good guess about a hydrocele just from a physical exam. But the ultrasound is the single most important investigation to confirm it with certainty, and crucially, to make sure nothing more serious is being missed. So there we have it. We've confidently figured out the what. The diagnosis is clear. But that just opens up a whole new question, doesn't it? The question of why. what actually causes that fluid to build up in the first place? Well, that sounds like an investigation for another time.